Hi, hope you're all doing well today. And I wanted to let you know that we're going to be talking a little bit about Kybella. You may have heard about Kybella in the past. It is a wonderful medication that is utilized to help get rid of that stubborn double chin fat that just won't go away even when you're dieting and um, can help really contour your jawline a little bit better. What it does is it helps break that fat down, and it does that by using something called deoxycholic acid. And the deoxycholic acid is something that we do have naturally in our bodies, but this is in a concentrated form, and it is injected into that fatty tissue, and it breaks down the fat cells that are in that tissue. It causes them to actually die, and when the fat cells actually die, they get broken down by the body and they're eliminated through your natural elimination processes, and they don't come back. You only have so many fat cells in so many places, and once that fat is gone, that fat is gone. So that is a really great plus with Kybella. One of the things that happens is we'll ice you, we'll take a look at you, and then we will do a treatment. And the treatment is really specialized to your individual needs. What we do is we use a special templating tool that allows us to take and actually create a matrix or template under your chin. I'll kind of use this little guy here because I can. But it creates, just like when you're getting a tattoo, you get a temporary marking. It will create a temporary marking underneath your chin. And what we'll do is we will go through and specifically mark the areas that we want. And the little temporary tattoo that we put on there helps us ensure that we are injecting the Kybella at the right spacing to maximize your treatment effect. The process doesn't take very long, um, but it can be, as everybody says, a little spicy. So that's one of the reasons why we will make sure that we ice you ahead of time and you have an ice pack afterwards. The spiciness does subside after a little bit, and it is tolerable, but it can be a little bit intense. And the reason I share that with you is I'd hate to say that, oh, it's no big deal, and then you feel that sensation and wonder what the heck is going on. So I would expect to have a little discomfort, but that ice does help afterwards to numb the area and keep that sensation down. So one of the questions I get asked a lot is, how many treatments do I need to have? And the answer is not the most straightforward. It really depends. Depends on how big the treatment area is and how well your body responds to the treatment. Typically, it takes anywhere from 2 to 4 treatments to get to where you've got that more chiseled look that you're going for, and that double chin gone. But some people may see the desired results in as few as 2 treatments. So it really is based on how your body responds. The first treatment, we have you come in and we take pictures. We'll always take pictures just so that we can look at where we're starting with, and we can always compare what you are looking like and the results later. Sometimes we forget what we looked like before, or we start focusing on something else we didn't notice before. So we want to really be able to give you an accurate and honest understanding of where you started and where you have come. And once we do the pictures, then we will cleanse your face. Like I said, we will go ahead and do the marking up so that we identify the areas that we want to inject. After that, we drop the medication, use a small little needle. Use a lot of times I will use actually insulin syringes. The needle is very, very tiny, very, very small, and we will inject into those different points. Like I said, those different little points that we've put on to your skin. Afterwards, we will cleanse your skin and you will be able to put ice. You can go about whatever it is that you want to do. You may want to take some Tylenol, some ibuprofen. If you're a little achy, you might notice some swelling. A lot of people will have swelling for a couple days. Occasionally, people have bruising. Sometimes the bruising may be because we've gotten near a blood vessel, but other times it could just be the way your body responds. But over those couple days, you'll notice that the swelling goes down. And over the next 4 weeks, 2 to 4 weeks actually, you'll notice that as the swelling goes down, some of that fat will be gone. So in 4 weeks, we have you come back and we take a look. We go through the whole process again, identify the areas that still need treatment, and then we treat you in the same manner. We have you follow back up in 4 weeks, and if everything's where you want it, great. If not, we treat you again. And hopefully that after those 2 to 3, possibly 4 treatments, you've got the look that you're looking for, and that double chin will be gone and it won't be coming back. If you have any questions or anything that you would like to ask, feel free to put them down below. And if there are any topics that you would like me to talk a little bit about so that you can understand them better, feel free to put them in as well or send me a message. My goal is to help make sure that you are educated and you are informed about the different procedures and treatments that are out there and how they can help you. Have a wonderful day, and I will see you again soon.